Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I am joined by my dear friend, Mark Testa of Regenexx. Thanks for being on, Mark.
Good morning, Sally. Thanks for having me. I'm glad to be here. It's always fun to talk to you.
Likewise. I'm deeply familiar with Regenexx, but for our audience that may not have heard of the company or used it yet, can you give a high-level overview of what Regenexx does?
Sure, thanks. Regenexx is an elective orthopedic surgery alternative. We're using the patient's own cells from their blood, like platelet-rich plasma, and from their bone marrow concentrate. And we concentrate that in the doctor's office, and then using ultrasound or fluoroscopy, video x-ray, we put their cells back into their body to treat musculoskeletal pain, arthritis, rotator cuff tears, back problems, etc. Things that would generally go on to elective orthopedic surgery, we can get in front of and reduce the need for up to about 70% of elective orthopedic surgeries.
A large chunk of surgeries are orthopedic. So can you talk a little bit about the impact that this has in an employer-sponsored health plan?
Yeah, this is a big impact for multiple reasons. We'll come back to cost in a second, but members' opportunity to avoid going to surgery. People put that off because no one really wants to do it. And so their problems get worse. There's a lot of people that go to work in pain that may not necessarily be effective at their job because they have pain. They take medications. People in pain are greater utilizers of the healthcare system. That's published in the literature. People in pain, their pain touches the entire health plan. Diabetes gets worse, weight goes up, anxiety and depression gets worse, metabolic health gets worse, sleep gets worse. So people in pain are costing the plan a lot of money in different ways. The cost savings for the employer is big, right? We have a Validation Institute piece that showed a 49% cost savings across the board by replacing up to 70% of elective orthopedic surgeries using these needle-based approaches. So members are really happy because they have an option in care. They can do something different to get out of pain that doesn't take them out of the game for a long time, meaning missed work or things like that. And employers are really happy about it because they're getting an immediate cost savings when their members utilize this. There's no upfront cost to use it. There's no PEPM. And so really it's a win-win for plan sponsors and their members to utilize these services.
Talk about the return to work time versus a traditional surgery.
Yeah, because these are needle-based and not open surgeries, people generally get back to work in days, not weeks or months. Definitely not months. And that's an important thing for people. You know, I still see patients, and so I know with a rotator cuff repair, that's 6 weeks off of work and 6 to 12 months of really rigorous rehab if you want to get full range of motion back in your shoulder or prevent frozen shoulder, which is another potential year of rehab to get that to work. So people get back to work quickly. Now, you know, if you're a fireman or a police officer, you might not get back into full duty immediately, but you can get back to the desk. And most people do get back to desk work literally in days, not weeks or months. So that's big for employees, again, because not everyone has 6 weeks of money sitting in the bank where they can be off of work. People need to actually go to work. And so that's another reason we hear from members that they love it because they didn't really miss much work that day. So that's a big deal for people.
Absolutely. Can you talk a little bit about the candidacy process? Is it anyone and everyone that comes, that's, you know, a candidate for surgery can elect to have a Regenexx surgeon instead, or what does that look like?
Yeah, that's a really good question. So at the most, 2% of the plan would be an appropriate candidate for this. So not everyone's going to come running to us. The appropriate amount is 2%. Now, we have a few guardrails on that. Number one is our candidacy grading. And we've been doing this for 20 years this year. We have the world's largest registry on these procedures with probably close to 100,000 patients in there. So we're looking at that data. We're looking at other evidence-based data on regenerative therapies like this, and we sort of mash that together, and we're able to give someone a good, fair, or poor candidacy grading based on their condition and their health and their imaging. And so when we are able to give someone a good, fair, or poor candidacy, we know we're, number one, choosing the right candidates. Now, poor candidates, we don't treat. We don't spend plan sponsor money on trying something that the evidence shows isn't going to be effective. So that's our first step in candidacy. Now, people often ask me, what makes a poor candidate? And that's a really good question. So we can intervene on a lot of conditions, but I'll give you a couple. Rotator cuff tears. There's 4 tendons that make up the rotator cuff. If you have 3 major rotator cuff tears, or the tear is separated by more than a centimeter, that's probably a good surgical candidate. People with really big disc protrusions in their spine, generally probably a better candidate for a surgical intervention. Same with ACL tears. So there's certain conditions that are just not good candidates for this, but again, it's probably 30 to 40% of people would not be a good candidate, but the rest are.
So I'm assuming that means you have some type of prior authorization process.
We do have our own prior auth or utilization management. Again, we try to spend plan sponsor money like it's our own. So again, couple guardrails on that even. We're using Optum's tool called Interqual. Interqual is an evidence-based tool that surgeons use, that they have to enter criteria to make sure that that patient is a surgical candidate. Then their surgeries get approved. So because we're trying to avoid elective orthopedic surgery, we want to make sure that that person also is a surgical candidate. And so we enter data into Interqual and get that answer. Now, then we have a couple other steps in the process. Did that person already exhaust or use conservative care? So if they hurt their knee 6 months ago, but they didn't do physical therapy, that's where we start them, right? We want to do the least expensive and the least invasive thing first. And if they've done all that conservative care and they are a surgical candidate, we don't make them go backwards to do conservative care. We'll go ahead and approve them for the Regenexx procedure. Our goal is to avoid surgeries. So we know that person's a surgical candidate, and we know that we are not skipping over less expensive, less invasive procedures like PT. And so roughly 30% of people who start off in conservative care don't need to come to us. Physical therapy or a low-dose steroid might have addressed their problem. So again, we're really trying to spend plan sponsor money like it's our own and making sure we're choosing the right people before we move forward with the Regenexx procedure.
Which is not always the case when you step into a traditional hospital setting. There's not a scrutiny on anyone's bottom line. So
right.
Can we talk a little bit about cost? You mentioned utilization, and I'm curious, both for the employer and the employee plan member, what cost looks like.
Yeah, that's a really good question. Our average cost for a procedure is about $9,000. It's lower for some, obviously, right? With the platelet injections, it might be higher for someone trying to avoid a knee replacement, but the average is around $9,000. And we look at that really kind of regularly over a large number. So that's a good average. When we look at the average surgery costs that we're avoiding, it's about $28,000. So immediately there's this big cost difference between a needle-based procedure using your own cells and an elective orthopedic surgeries. We don't have facility fees. We don't have anesthesia costs. Obviously, we're doing this in an outpatient setting. So all those costs are immediately taken off the table, which allows us to do this at a significantly lower rate than surgeries.
And do you have any employer success stories you can share? I know you've got a lot, but pick your favorite.
The one I like a lot is Viking Yachts. They were one of our first clients. They make yachts and they have an on-site clinic, which I love working with because they identify people really quickly and they refer appropriately and they can manage the imaging. And so their head of their benefits shares with us how their members love this. Their cost savings is also very substantial. We just added another clinic down in Florida where they have another company manufacturing part of their company that does ship repair. And so now we're really able to deliver care to both of them. But their plan sponsor, their head of HR benefits talks about not only people getting back to work in less than a week, but, and this data is a little old, but the hourly costs when their people aren't there was roughly $100 an hour of productive time they're losing when someone's not there, especially on a manufacturing line where somebody's really good at doing what they do and now they're not there. So cost savings big on that side. I think last year we looked at their cost savings. It was about 60% versus the surgeries avoided. And then their hard costs of when somebody's not there to do their job at roughly about $100 an hour in lost productivity time. So they've been with us, like I said, since maybe 2017, and they're still going strong.
So obviously our audience for the podcast is brokers, consultants, benefits leaders. Looking at what you're expecting for 2025, what are some things that they should have top of mind as it relates to surgeries, musculoskeletal issues? What's your advice?
It's not going to get better by itself. Costs are going to continue to go up. They're going up. I don't know where we are on the aging workforce, but musculoskeletal problems are ubiquitous. It doesn't matter what age you are, what industry you're in. It's still the number 2 or 3 costs on most health plans. It's one of those things. And for 2025, regenerative therapies like this are part of all of orthopedic continuum across the United States. I still see patients, so I see it in use. It's performed in 70, 80, 90% of academic medical centers across the country. University of Colorado does this, Emory, Stanford. It's done in centers of excellence, Mayo Clinic, Cleveland Clinic, Hospital for Special Surgery. This is just part of orthopedic medicine now as a step before surgery. There's a lot of evidence for it now. There's roughly 150 randomized controlled trials on PRP alone. And so all those places I mentioned, you know who gets it? People who have means. So it's important for benefit advisors, I think, to help bring these solutions that are accessible to people with means to health plans where people can get access to it covered by their insurance benefits, paid for by their employer, because this is part of the system already. We need to incorporate it more into employee benefits. And while I say that, we have roughly 3,000 clients that are doing this. So no one's going first anymore. This is already out there. People know about this. It's performed everywhere. Let's give people the opportunity to have access to it at greater levels in 2025 because it's just the right thing to do. And it's the direction we're going in orthopedic care. And like I said earlier, costs of surgeries are not going down, and surgery is not a sum zero game. People end up sometimes worse from it. And, if there's a safer way to do it, now's the time to do it.
Absolutely. Well, thank you for sharing that with our audience. We wholeheartedly agree. We are so proud to have Regenexx as part of our Granite List community and really enjoy our personal friendship, Mark Testa. I highly encourage anyone that's listening to follow Mark on LinkedIn because he puts out fabulous content, sometimes witty, sometimes serious, always informative. And we really appreciate you being on an episode of the Granite List Live.
Thanks so much, Sally. It's always great to talk to you.
Absolutely. We really appreciate it. And thank you to our audience for tuning in to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.